Welcome to this short video on Wilson's disease. Wilson's disease is a rare recessively inherited condition of copper transport, causing overload, especially in the liver and brain. It is eminently treatable if caught in time. The clinical presentation is extremely variable, with children and young adults particularly affected. The archetypal sign in Wilson's disease is the Kaiser-Fleischer or KF ring, but there are many nuances to how patients present. We have brought together a number of specialists in the field to highlight the early signs and symptoms so that diagnosis and treatment are not delayed. The risk otherwise is progressive neurological disability, liver failure, and indeed death. Professor Aller, what might indicate hepatic involvement by Wilson's disease?
Well, patients may present with lethargy, bleeding, or raised liver enzymes. A low platelet count could indeed signify chronic liver disease. Liver ultrasound may indicate fatty liver or indeed cirrhosis. And on examination, patients may have hepatosplenomegaly or spider nevi.
Thank you. Dr. Shribman, what neurological features should we be looking out for?
Some people develop tremor and other involuntary movements which can initially mimic essential tremor, whereas other patients develop slowing of movements which can look a bit like early onset Parkinson's disease. Problems with slurred speech and drooling can be an important clue which can help differentiate Wilson's disease from other more common causes of movement disorders.
Let's delve into that a little more. Dr. Headley, what do we see in children?
I think children presenting with features of Wilson's disease can be challenging because they can have subtle features, things like subtle behavioural change, changes in mood, changes in school performance, things like handwriting difficulties, problems with walking, clumsiness. And then if you see that as a feature in association with an earlier illness like a viral hepatitis, this should be a red flag. Slurred speech as well is a common presenting feature which is unusual in children, and Wilson should be thought about in that situation.
We've heard a lot about psychiatric symptoms. Could patients get labelled and Wilson's disease missed? Dr. Okai.
Well, the neuropsychiatric features very much mirror the neurological features. So in neurology, you'll see disinhibition of movement. That manifests in psychiatric terms as disinhibition of behaviour. People may become more irritable or frustrated, or even at times become more aggressive verbally or physically. You also see slowness of movement in Wilson's, and that results in slowness of thought processing and, again, difficulty with initiating thought as much as they do have problems initiating movement. Finally, there are a range of other conditions that can occur, such as mania, psychosis, and it's worth mentioning that if you have a patient who has a psychosis or a mania, they may be on medications, even if it's thought that there's a possibility that their medications are causing liver dysfunction. One should still check for Wilson's, especially if any of the other features I've mentioned are present.
So, a combination of neurological, psychiatric, and liver problems strongly suggests Wilson's disease. Professor Aller, what further testing can be done?
Well, the key here is to refer early in any suspicion of Wilson's disease, and there's recent guidance for physicians from the UK, Wilson's Special Interest Group. The starting point is low serum seroplasmin, which is typically less than 0.1 grams per litre, though you can have normal levels in Wilson's disease. A raised 24-hour urine copper excretion, and an ophthalmologist looking very closely for Kaiser-Fleischer rings, genetic testing, and or liver biopsy.
So the important takeaway here is to think about Wilson's when you see a child or adult with unexplained liver disease, neurological symptoms or psychiatric symptoms, particularly in combination. This is so that early treatment can be started and long-term disability can be prevented. Thank you for watching.